Welcome back, everyone, to Open Line. Talking about the coronavirus, the Delta variant, and also vaccinations. And we are hoping you will call in with your questions, thoughts, whatever. We have Dr. David Aronoff here, Director of Infectious Diseases at Vanderbilt, and several calls. So let's just go right back to the phones. Let's go to Anne. Anne is here. Hello, Anne.
Hi, good evening. First, I have a comment about Mike's call, and then I have a question for the doctor. And I think my interpretation was that what Mike was saying while being a gentleman, that those 10 states were red states, where the governors like Bill Lee did what the president, Donald Trump at the time, said, and that's where they took their lead, and that led to a lot of misinformation. And now you have those 10 states that are lagging in shots being given, and people still with great hesitancy to take these vaccines. But my comment is now for the doctor is we're into this for some time now. And when we started this, there weren't studies for people that had autoimmune disorders. And my question is, have there been studies done now on the efficacy of the vaccines for people with autoimmune disorders? So that fear can be laid to rest. I myself had some issues taking the vaccine. I'd do it again in a heartbeat. But one of my questions has always been, how effective is it for me? And since I had issues and delayed responses and activity with my lupus, with the second vaccine, was it as effective as it would have been for someone without autoimmune problems? So
okay.
I'll leave it at that and wait for your answer.
Okay. All right. Autoimmune, she's asking for that class, I guess. First of all, explain what that is and I guess answer her question.
Yeah. So, Anne, thank you for your question. This is a common question that we get from the general public about conditions like autoimmune diseases. Autoimmunity refers to essentially when our own immune system turns itself onto us and starts to attack us. Sometimes it attacks our skin or our kidneys or our heart or our muscles, and it creates symptoms or disease. And often those diseases get managed with medications that suppress our immune system so that we're less likely to really beat up ourselves with our immune system. And so your question, Anne, is a very complicated one because every individual who has an autoimmune disease may be managed somewhat differently. So some people may be on medicines that make it harder for their immune system to respond to a vaccine. Other people may not be. The good news is that data that we've seen emerging suggests that these vaccines are safe in people with autoimmune disease. The degree to which they're effective depends a little bit on whether these patients with autoimmune disease are on medications or have other conditions that would suppress their immune response to the vaccine. So my advice, anytime someone with an autoimmune disease asks me about getting vaccinated, is engage with your licensed healthcare professional and ask them whether they think now is a good time, where you are in your treatment for your autoimmune disease, to go ahead and get vaccinated, whether there's a particular vaccine that's better for you than another one, and if there are any special plans for continuing to keep you somewhat protected or guarded from getting COVID-19 even after you're vaccinated. So big, broad question, and I hope that's at least somewhat helpful.
Very good. Good question. Good chance to ask that question. Let's go to Megan. Megan. Hello, Megan.
Hi there. How are you?
Fine. Go right ahead.
Well, first off, I want to start off by saying that I feel sorry for everyone that has got COVID. But I also want to say that I don't feel like we should be forced to get the vaccination to go on like cruise ships and airplanes and all of that. I just feel like it's the mark of the beast. And I don't feel like I should be pressured to get something to enjoy family time.
You feel like it's the mark of the beast? Is that what you said?
I do. because I mean, it's in the Bible.
Okay. Where are you calling from?
I'm calling from Tennessee.
Okay. All right. Well, thank you. I appreciate your call. I know you're not alone. So there. Here's somebody saying it's the mark of the beast. It's in the Bible, and they don't want to get it. What did you encounter that when you were out, talking? What do you say there?
Well, first of all, thank you very much for your call. And I think voicing these kind of concerns is really important for us to understand reluctance to get vaccinated. For sure, we're not forcing people to get vaccinated, but there are businesses and situations where it may be required to get vaccinated, maybe certain cruise ships, because being unvaccinated and having COVID doesn't simply present risk to you as the unvaccinated person, but could create a potentially lethal situation for somebody else near you who may also not be vaccinated or be immunocompromised or in a high-risk group. So getting people vaccinated turns out to be not only important for protecting the individual person who got vaccinated, but for ending the pandemic and making it hard for the virus to find another victim. And so this is really a public health crisis that demands an appropriate response to protect people. People need to understand that we currently live with a system of regulations and laws that are often in place to protect us. One of the reasons that in many restaurants we can't smoke cigarettes is because we know that secondhand smoke can be dangerous to people nearby. Well, with COVID-19, our breath can be lethal to somebody nearby, and we now have the ability to end that pandemic. And similarly with seatbelt laws or having traffic lights, the reason that we have red lights or stop signs is so that people don't barge through and end up hurting themselves or other people. And it's similar with these decisions that businesses are free to make around protecting their employees and protecting their customers from the threat of COVID-19.
So you took maybe the high-end side of that, where she was concerned about being required to take a vaccine to get on a cruise ship or a plane. The other part of what she said is she thinks it's the mark of the beast and it's in the Bible. How do you respond to that? I mean, what do you say when you hear that? And is it frustrating to you to hear that? And I don't want to belittle her completely, because I know there are people that say that, but let's say, how frustrated are you to hear that, and what do you say to that?
Well, I think for one thing is that in many religious communities there are leaders who understand the importance that vaccination plays in ending this pandemic, and can help educate their congregation about how we've been given the ability to develop a powerful tool to protect ourselves and the people we care about the most. I'm not a biblical scholar, but I don't think SARS-CoV-2 or COVID-19 are in the Bible. And we're living in the 21st century where we really do need to be taking advantage of the things that we've been able to create to end a global public health catastrophe. Just like evacuating people off a beach when a hurricane is about to hit and to make landfall, we're needing to intervene and say, get vaccinated, create social distance, wear masks. We're here to try to protect lives and save lives. And it's just my hope that reason and truth will win out.
Okay, let's hope so. Let's go to Victoria. Victoria, are you there?
Yes, I'm here.
Go right ahead.
Hi, thank you all so much for this topic of discussion. My concern is children that are under the age that are not at the point of getting the vaccine. My question is, of course, with this new, variant that's out, this Delta variant, what are your thoughts about children as far as going back to school, and of course being around other children, and of course their parents that are not vaccinated? What are your thoughts about that, children going back to school? That's what I would like to know. Thanks.
Thank you, Victoria. What about that?
Victoria, thanks for asking that question. Schools have been on our mind a lot this summer, and we're heading back towards school time. And there's a few things that we need to keep in mind. First of all, one of the things that has not changed about this pandemic is that it disproportionately affects adults. Children can get sick, and they can get very sick with COVID-19, but they're at much lower risk for getting seriously ill compared to adults. So when it comes to operating schools, it is really important that people who can get vaccinated. In addition, we've learned that we can safely operate schools by adding measures that help reduce the risk that transmission events are occurring even within the groups of children. And some of that is around how we cohort the children, how we space them out in their classroom, how and where they eat lunch, whether there are any kind of plastic or other barriers between certain kids, how the ventilation and air filtration are in classrooms. And so we need to continue to do the things that are in our power to reduce the risk. But one of the most important ways that we can keep our schools safe is to keep disease activity outside of the schools low. And how do we do that? We get people vaccinated. And so it really does right now boil down to the fact that we need to make it difficult for this virus to find another person to infect and to break the cycle of transmission. And the best, safest, most effective way we have to do that is through immunization.
And quickly, before we go to break, do you feel like there will be a vaccine? Right now it's 12 and older can be vaccinated. I believe what she's talking about is the younger kids, first, second graders, that kind of thing. Will there be a vaccine, do you think, by the start of the school year for 12 and under?
I don't think by the start of the school year, but let's be targeting the holiday season.
Okay. All right, we're going to take a break. If you're on the line, hold on. We'll get to your call. Take a break. Be back right after this.